The study I will be reporting on is called Dog-Assisted Therapies and Activities in Rehabilitation of Children with Cerebral Palsy, Physical and Mental Disabilities by Almachi and Savitsky. This study of 10 individuals between the ages of 4 and 23 with varying disabilities was performed in Antalya, Turkey from 2008 to 2011. 5 groups were formed, some of which had multiple patients in them, whereas others only had one patient in them depending on their disability. The intent of the study was to determine whether or not dog-assisted therapy could enhance the therapeutic effects of occupational therapy in the clinic. Groups performed various activities with the dog designed to test the specific skill that they had been working on in therapy. Sessions were video recorded and later reviewed to determine whether or not positive changes had occurred. The independent variable here included the dog-assisted therapy. Dependent variables, basically what they were measuring, varied depending on the individual, but included fear, anxiety, goal setting, planning, body utilization, empathy with the dog, asking for help, communication, bowel motility, decreased muscle tonus, and treatment compliance. This article makes the causal claim that all patients improved in their corresponding focuses of therapy. So the study established construct validity by using each patient as their own comparison group. There was no control group, but this allowed for a more accurate measure to be made using only observation and interviews to assess the improvement of each patient. The limitations presented for construct validity included the fact that there was no physical scale or assessment performed, and instead occupational therapists observed changes prior to and after therapy to determine if there was any improvement. External validity was established because the study involved both genders, a variety of ages, and different types of disabilities. However, the study only involved 10 cases in Antalya, Turkey, and these participants only came from the clinic they had already been attending. So we can't really generalize 2 different cultures or older age groups. Statistical validity was a problem. It was not established. There's no way of assessing the p-value because they didn't use a scale. So basically they did just use the interview and observation process to determine whether or not there was an effect on the patients. Internal validity. It was established by focusing on the specific needs of each patient, allowing each patient to act as their own comparison group. However, there is the possibility that therapists were more enthusiastic during the session due to the dog being present and therefore performing better therapy. Due to the fact that groups were determined by assigning certain patients to certain groups, selection effects may have occurred. And as this specific population often has varying emotions and actions and challenges, there is a possibility that maturation and history also may have occurred, history effects. Also, there is high possibility that observer bias and demand characteristics occurred because the therapist may have been more enthusiastic about the dog-assisted therapy, hopefully improving each patient, and the patients may have expected that they were being studied and therefore enhanced their behavior to impress the therapist. So in the future, if a study like this was to be performed again, I would hope that therapists would randomly assign patients to groups, maybe find a scale or assessment to actually collect data so that they could determine a p-value to determine if statistical significance had actually occurred.